My name is Sean Fitzgerald, and I'm speaking to you today from Jasper, Alberta. I'd like to begin today's meeting by acknowledging that the College of Physiotherapists of Alberta's offices are located on Treaty 6 territory, as well as the Métis Nation of Alberta's Region 4, which has been and continues to be the home of many Indigenous peoples since time immemorial. The College of Physiotherapists of Alberta recognizes that Indigenous peoples have been helping many live healthy lives on this land long before settlers arrived. With that, we commit ourselves to helping move people forward in their journey towards a good life and doing so in a way that follows the spirit and intent of Treaty, that of peace, friendship, and understanding. We also recognize that people from across Alberta and beyond are joining us today, and we encourage you to take a few moments to learn more about the lands, peoples, and treaties with which you may be in relationship. It is my pleasure to welcome Tim Bartlett and Ed Breet. Tim is an occupational therapist, health sociologist, and assistant professor in the Department of Occupational Therapy at the University of Alberta. His research is at the interface of occupational science and the sociology of health, exploring the socio-political aspects of everyday life and pursuing transformative change. Ed is a physiotherapist and master's student at the University of Alberta under the supervision of Tim Bartlett. His work is focused on exploring the taken-for-granted assumptions in physiotherapy through deconstructing our past, both philosophically and historically, so that we can create a physiotherapy which is affirmative of change and difference. Again, I'd like to welcome Tim and Ed, and I'll hand this presentation over to you.
Thanks, Sean. Yeah, my name's Tim Bartlett. Ed and I are happy to be here. I'm really grateful to receive an invitation. Leanne Loringer and I started talking earlier this year. I think it was maybe around May or June, or possibly earlier, about could we have a webinar around critical perspectives? Could we have a webinar around critical research and what that might offer physiotherapy? And I started to have a conversation with a few folks in rehabilitation sciences over the last couple months, collaboratively talking about what would we want to share in a webinar with the college, and how might we want to engage with the college around taking a critical perspective. So you'll see on the screen that this presentation was developed by Christine Ha, Ed Breet, Aaron Javel, who I misspelled Aaron's last name, so it's D-U-E. I apologize to Aaron for that. Terry Slade and myself. So we spent some time brainstorming ideas and collectively pulling this together. I know that Sean's given a land acknowledgement, but I want to offer my own personal land acknowledgement and acknowledge that I'm an uninvited settler in these lands. My family traveled to Treaty 6 territory in the early 1900s. My family settled in the Vegreville area around 1905, and I've only recently come to understand how my family benefited from farming policies that encouraged settlers to create a future for their families, and that these benefits weren't offered to First Peoples. And in fact, some of the First Peoples in the area were prevented from accessing mechanized farming equipment, equipment that helped my family establish and settle on their farmland. So this is part of my history, and I benefit from this colonial history. So I'm presenting from the territory of the Nehaya, Cree, the Niitsitapi or Blackfoot, Métis, Nakota or Stoney, Dene, Iroquois, Anishinaabe or Ojibwa, and Saulteaux, lands that are now part of Treaty 6, homeland of the Métis, and I acknowledge the many First Peoples, knowledge keepers, elders who have lived in, cared for, and thrived on these lands for generations, recognize their footsteps on and connection to these lands, and rich contributions to our communities. Now, land acknowledgements are, I don't consider this as something separate from the topics that we're discussing today. A land acknowledgement is an excellent place to start a conversation around taking a critical perspective. A land acknowledgement is an invitation to consider history differently, to consider ourselves in relation to history, to consider how we're a part of that history, how aspects of history have been silenced or ignored, how history has been erased, how Indigenous culture has been erased, language and people. So this webinar is also an invitation to listen to and turn to what has been silenced, omitted, or erased. So we've already had a little bit of an introduction to who we are. My name's Tim Barlott, it's already been said. My pronouns are he, him. I'm an occupational therapist, sociologist, assistant professor at the U of A in occupational therapy. Before I was an occupational therapist, I worked for a while as an addictions counselor, as a youth worker, and then made my way into the OT profession. I worked for a number of years in home care, working with folks with long-term chronic and neurological conditions in the community. And then from there, I did a research-based master's looking at the exclusion of disabled folks in partnership with a community in Bogota, Colombia. In 2014, I headed off to Australia. If you're in Edmonton right now, we had a bit of a snowfall, so I wanted to, back in 2014, I wanted to escape things like that to a warmer destination. So my family moved over to Australia. I got my PhD in sociology over there while working at the University of Queensland. My PhD looked at community connectedness for folks who have been psychiatrized, folks who access psychiatric systems, and what mutual relationships might be like between people in the community and people who've been highly excluded and marginalized due to their psychiatric diagnoses. So most of my work is looking around the theory and practices that enhance community connectedness and theory and practices that are informed by people who have lived experience. So that's a little bit of an introduction to my work and my background. I'll turn it over to Ed now.
Hi, my name's Ed Briet, as has already been said. My pronouns are he, him, and I'm a physiotherapist, master's student at the University of Alberta under the supervision of Tim Barlott. And as has already been discussed, my work is focused on exploring the history of physiotherapy and our taken for granted assumptions that have formed the profession, and looking at what deconstructing that history might provide us, and what kind of a physiotherapy might come out of deconstructing where we have come from. So I grew up in South Africa, and I was both educated in South Africa and did my physiotherapy undergraduate studies in South Africa. And I've worked rurally in South Africa, in South African communities after my undergraduate studies, working with a lot of underprivileged communities just outside of Gauteng, the province of Gauteng. And thereafter I moved to New Zealand, where I also work rurally with communities in New Zealand in the Upper North Island. So I've been, that's a bit of my background. A large proportion of my perspective is strongly influenced by my South African upbringing. The ongoing, as a lot of you might know, the ongoing violent effects of apartheid and the apartheid regime continue to be felt in South Africa and are still very clearly visible in the country. And also, having moved away from the country, it becomes more obvious how it affects our profession as well. And I think it's quite interesting to delve into that aspect of physiotherapy. And I benefit from the colonization of South Africa, being a white South African from an Afrikaans heritage, and I think it's quite important to look into that and dig into that a bit, and that's one of my interests. Yeah, so that's a bit about me. So this session is going to cover what is a critical perspective, what can a critical perspective offer physiotherapy, and what actions can we take. So this is not a topic necessarily, but an invitation to reorientate how we think about our professional practices. It's an invitation to engage with thought outside or on the margins of the status quo. This is not only an individual invitation. Individual responsibility alone will not change the system that we are a part of. For example, we can recycle straws all we want or try reduce our household waste all we want, but it's unlikely to impact the climate as long as there's no systemic change. And I think this is also the same for physiotherapy. We can try to take this on our own shoulders and kind of guilt ourselves into trying to change something about our own individual responsibility, but I think the picture is a little bit bigger than that, and we've got to look at the system as a whole and do this as a team effort. So you will not leave with 3 key practice implications. There is no simple recipe for taking on a critical perspective, but still we invite you into the conversation and hope that it continues. If I were to say, take a critical perspective on something, what does that mean? What does it mean to be critical? So in this picture, what do you see? I just encourage you to take a moment to look carefully, and we're obviously looking at a Toblerone logo. We obviously see the word underneath the mountain, if you can see the mountain as well. Do you see anything else? Apologies if you've already know that there's more to this image. I know it's been floating around for a while, so maybe you've already seen this before. Now that I've blown it up, what else do you see? Do you also see the bear that is within the mountain, right up in the middle? Critical thinking is about considering that there is always something more to see, always another message beneath the surface. Sometimes difficult to see, and sometimes we have trouble seeing other perspectives without someone else pointing it out or drawing our attention to it. We tend to view the world in a particular way and are blind to other worldviews. This is the taken for granted aspects of everyday life, or the status quo.
Now, critical perspectives or critical thinking has been described by Ronald Barnett as involving the capacity to become an other, to inhabit, if only briefly, a cognitive perspective that is unfamiliar. So critical thinking involves taking on an other or an unfamiliar perspective, something different from the common perspective, maybe something different from your current perspective. It's looking for rival formulations. It's looking for alternatives, considering that things could be otherwise. Something different from what's in front of you. So if the Toblerone logo that Ed had on the screen, that there's a mountain in the Toblerone logo, but it's also a bear. But this definition of a critical perspective is still incomplete. One of the things embraced within critical perspectives is plurality. But there's always something else. There's always another perspective, and within this perspective, there's still also something missing. While Ronald Barnett, who's a white American man, and his work does encourage questioning universal assumptions, it's somewhat politically disengaged. It doesn't acknowledge the importance of considering power relations when taking a critical perspective. So let's try it again. Consider another perspective on what a critical perspective is. Here we draw from Lori Patton and Natasha Kroon, two Black American scholars, to deepen how we define a critical perspective. That it's not only taking another perspective, it involves the interrogation of what is taken for granted, whereby we search for what is silenced and ignored, not just searching for an other point of view, but what are the points of view that are silenced and ignored? Surfacing the ways that these silences cause harm, and not stopping there, but to take a critical perspective is also to take action to eliminate these silences. On the screen, we've got a cartoon of one fish saying, "How's the water?" to another couple of fish, and the other two fish say, "What the hell is water?" The taken for granted, the underlying conditions of society is by nature very difficult to see. It's what we swim in. It's all around us. We're immersed in it. The world we live in. So taking a critical perspective requires some intentionality. Now, taking a critical perspective, and critical perspectives are not only about criticizing. Critical perspectives are often confused with criticizing and simply finding fault. Finding fault and only criticizing without seeking alternatives can be unproductive and can fail to achieve transformative outcomes. So an example of a critical perspective that goes beyond criticizing is a strengths-based approach, which comes out of taking a critical perspective. Now, strengths-based approach started with identifying that clinical spaces are often concerned with finding problems and finding problems that require fixing. It was very focused on a problem orientation. So whereas a strengths-based perspective looks for strength, intentionally looks for strength, something that's often ignored in clinical spaces in order to build on it. So critical perspective is not solely criticizing. Critical perspectives can also create discomfort. As an example, my wife and I went to the bank a while ago, talk about our mortgage. And the banker, a man, when talking about the numbers and calculations, and the majority of our conversation spoke to me. The conversation started with the three of us, but as we started getting into the details, the banker solely addressed me. And I ended up only addressing him. Afterwards, we're walking out. I'm feeling good about the meeting. I feel like we've got an understanding about our mortgage. And my wife said to me, "Why did you cut me out of the conversation?" And I replied, "I didn't." And she said, "Didn't you realize that as soon as he started getting into the details, he only addressed you and you only addressed him?" I stammered. I didn't know. I got defensive. My thoughts were, oh, well, maybe she's being a bit oversensitive. It wasn't that bad. I was uncomfortable. When the sexism and patriarchy of this situation was surfaced, I experienced discomfort. A Black anti-racist educator, Resma Menachem, describes the difference between danger and discomfort when we encounter taken for granted assumptions within situations. We'll often encounter discomfort when confronting information that challenges our vested interests. Resma is speaking specifically to race and racism, but this is also something that can be generalized to other topics. Now, danger is a call to act, a fight, flight, or freeze response, often immediately. When we perceive that we're in danger, we bypass our cognitive thinking into that fight, flight response. So my defensiveness might be an example of perceiving that to be a dangerous situation rather than discomfort. Discomfort, though, is a call to examine, to consider, and decide. Discomfort is an opportunity to learn and grow. For example, if I have discomfort with my clothing, I might need to adjust my collar. If I have discomfort in my mouth, I might need to make a dentist appointment or speak on behalf of someone who's being unjustly harmed. Discomfort requires cognitive thinking and discernment. White people often confuse danger and discomfort. And we can generalize this to other topics. So taking a critical perspective sometimes involves sitting with uncomfortable topics and sitting with discomfort rather than bypassing our cognitive processes and misunderstanding that discomfort with something that is dangerous. In our current political climate in Alberta, we're seeing the UCP call to remove critical race theory from curriculum. Might be an example of discomfort being confused with danger. Critical perspectives are creative. They're action-oriented. They evoke a response. They can involve movements, actions that generate space for other knowledges to have influence. And critical perspectives can take flight when action is taken up collectively, as groups of colleagues, as a college, as fellow rehabilitation practitioners. Here, Frias and Rudman say critical work is concerned not merely with how things are, but how they could and should be. What can we do differently? How can we think about something differently? What are the other possibilities?
Critical theory explores how relations of power, hierarchies, privilege certain groups of people, ways of doing, being, and marginalizes the other. Critical theory and critical perspectives often offer tools for uncovering the ways in which power operates in our society, how our society is structured in a way that resources are distributed unfairly, that some people and ways of living are discredited and delegitimized. For example, Sylvia Wynter, a Jamaican philosopher, discusses how dominant society unconsciously divides people into normal and abnormal binaries. She says this comes from our history, how we've defined the human being. We divide human beings into able and disabled, white and black. We are in some ways programmed with habits of thought, where we unconsciously group people into binaries of what is normal and valued and credible and what is abnormal and devalued and lacks credibility. Bringing these tendencies to the surface is an opportunity to think and act differently. I believe Tim had an example of a student in Australia. Tim, I don't know if you want to share that example.
Sorry, that was my cue to jump in. I had a student come to me a couple of years ago when I was teaching as an OT in Australia. She was Chinese Australian, born and raised in Australia. English was her first language, but she has a Chinese last name. After class, when we were talking about critical perspective, she came to me to vent her frustration, feeling like her anger was boiling over. She said, I am so sick of lecturers seeing grammatical errors in my writing and assuming that English is not my first language. She mentioned example after example of lecturers suggesting that she take English second language courses to improve her writing. She said to me, I've read other students' work and there are some pretty crappy writers, but the white students never get this advice. And so this is an example of the unconscious tendencies of her lecturers and how that made her experience difficult. That those assumptions that that creep into to our experiences and our habits generated additional labor for her. It created worries for her. How would she deal with it? How and when to say something? And worries about what is at stake if she was to speak up and say something. She's managing all that additional labor in a way that white students didn't experience.
We've decided not to focus on critical theory or on research that uses critical theory. Instead, we're going to focus on how we can use a critical perspective when engaging with research in physio. And we invite you all to use a critical perspective when looking for evidence to inform your practice. And so we're going to use our presentation as an example of how we might do that. Think for a moment. I want you to, or I'm going to do it as well, and to reflect on what scholars can you name within our profession or outside of it. Who are the credible names in physio research? A couple come to my mind, which I can mention. Obviously, there's someone like Paul Hodges or Larimer Mosley. Who were your professors at uni? And who are the keynote speakers at conferences? Do they have anything in common? And who might be left out? In Canada, physiotherapy lacks diversity, with limited representation in practice and research of racialized and Indigenous students and practitioners, and disabled students and practitioners. We've got to ask ourselves whose research informs physiotherapy practices. Primarily, which is uncomfortable coming from, for me it's uncomfortable as a white physiotherapist, primarily it's white non-disabled scholars. I say this fully acknowledging that this is also the case in other rehabilitation professions such as occupational therapy and speech and language pathology and so on. And that we both hold a position of privilege, and with that privilege also comes the opportunity to use our platform. Zoe Todd, an Indigenous feminist, suggests that when we only cite and draw from white, non-disabled thinkers, and not BIPOC and disabled folks writing about the same topics, we perpetuate the dominance and marginalization of certain people.
Now, as we were developing this presentation, our little collective was inspired by the work of Sarah Ahmed, who's a racialized queer feminist scholar, and Zoe Todd, who Ed mentioned just before this, an Indigenous feminist. Now they're calling for what Sarah Ahmed calls a citation rebellion, where we broaden the spectrum of who we draw from and who we reaffirm as knowledgeable. This is an invitation for practitioners, researchers, regulatory bodies, policymakers, university programs to cite, but not just to cite, but to, here we're talking about professional practice that draws from evidence. So an invitation to draw from Indigenous and people of color, disabled people, and others that have been left out, excluded, and silenced from academic discourses, and broaden what we consider to be knowledgeable. In our presentation, we have intentionally sought out and cited scholars from social locations that are often silenced. We're drawing from racialized, disabled, Indigenous, and queer scholars. This idea of a citation rebellion could also be considered an evidence rebellion, not a rejection of evidence-based practice, but an invitation to broaden the spectrum of where we get our evidence from and what evidence we bring into our practices and inform the decisions that we make. Now, Zoe Todd continues, consider digging around for others who are discussing the same topics in other ways. It is not that there are only white non-disabled people talking about topics of relevance to physiotherapy. There are others. They may not have the same platform and may require some digging to find. This is about evidence-based practice. This is about broadening the evidence that we draw from. Terry Slade and colleagues that were part of our conversation wrote an excellent paper about how randomized control trials need a little bit of feminism to acknowledge that there are perspectives and identities that are missing from the evidence that we hold very highly. And so this requires some extra digging. We'll say it again, this is not an individual invitation. This is a call for researchers to do extra digging, to look to see what others are saying. An invitation to the college, to university programs and policymakers to find and elevate the perspectives that are often ignored, silenced, or deemed uncredible. We're going to offer a small example of what might be learned from digging around from what racialized, Indigenous, and disabled physios are saying and calling for.
And so we asked, what are racialized and Indigenous physios calling for? We sought out racialized and Indigenous perspectives in Canada, and we wanted to find out, what are they talking about? Tracy Blake, a Black physiotherapist, and Katie Gasparelli, an Indigenous physiotherapist, along with their colleagues, are calling for a justice-informed approach to physiotherapy. Physiotherapy that is attentive and responsive to social determinants of health, an acknowledgement that non-medical factors and social inequities influence health. These include things like socioeconomic factors, education, unemployment, underemployment, precarious employment, housing, food security, social exclusion, and discrimination, along with access to health services. Responding to Blake and Gasparelli's call might involve digging further into what and how physiotherapists can bring an awareness of social determinants into practice. For example, Karim Nascuto, a Brazilian physio, recently published an article on disability and rehabilitation that offers a suggestion for responding to social determinants in low back pain care. Blake and Gasparelli also call for physiotherapy in Canada to respond to the TRC calls to action and for physios to become familiar with the calls to action, recognize their role in reconciliation with Indigenous peoples. This might involve becoming more familiar with culturally safe practices within physiotherapy. So what are disabled physios calling for?
All right, now this is handing over to me. This is an excellent question. What are disabled physios calling for? There's scarce, if any, literature from disabled physios. Why is this? There is literature on the difficulties experienced by disabled students who are in physio programs, the difficulties getting into programs, difficulties getting through programs, and also research that describes the feeling that disabled students and disabled physios do not feel welcome or don't fit in physiotherapy. At the end of this presentation, there are some additional resources on the slide, and one of them speaks specifically to the lived experience of disabled people in physiotherapy, but there is a lack of literature from disabled scholars in physiotherapy. The lack of disabled physios, the lack of lived experience expertise highlights that there's some ableism, not only within physiotherapy, but across rehabilitation disciplines, including my own as an occupational therapist. And it invites us to consider how is ableism embedded in our professions and how might we respond? Now, ableism is a network of beliefs, processes, and practices that produce a particular kind of self and body, the corporeal standard, that is projected as the perfect, species-typical, and therefore essential and fully human. Disability is then cast as a diminished state of being human. We need tools to see and respond to ableism. And one of those tools can come through the field of critical disability studies. Critical disability studies is an example of critical research that centers the experiences of disabled people in the production of knowledge. Critical disability studies came out of disability activism in the 1970s and 80s. It challenges disability as an individual problem. It explores the social, political, cultural, and economic factors that construct disability. Critical disability studies troubles the norm of an able body, considers that there is no normal human body, rather a diversity of bodies. Disability is not a quality of the person, but is constructed through social processes. Like when Ed was talking about the work of Sylvia Winter, how social processes construct what is normal and what is abnormal. So for example, if there was not access to eyeglasses, many of the people in this webinar would be disabled by the social circumstance. Many of our online presentations that we have don't have captions. So someone with a hearing impairment would be disabled by our normative ways of teaching. Egner says that critical disability scholars reject the idea that disabled people should wish to be able-bodied and seek to provide alternative narratives. Critical disability studies is a great place to look for disabled perspectives. There's a reference included in the reference list from Yoshida, who looks at critical disability studies and what it might offer physiotherapy practice, and offer an invitation to address some of the ableist tendencies and thinkings within physiotherapy and rehabilitation disciplines. Now, I'm not sure if you're familiar with stump kitchen. If you're looking for something to, you're scrolling through social media, looking for someone else to follow, this is a great place to look for an alternative perspective on disability. Alexis celebrates body diversity. She offers some incredible cooking ideas and challenges ableist assumptions about normal bodies. There's much for us to learn from people with lived experiences. So we are nearing the end of our presentation, or we're at the end of our presentation, and a time to open up for questions and discussion if that's of interest for people. But we do want to end with a summary about what actions can we take. If we're to leave one recommendation, one invitation, it's to seek out those non-dominant perspectives, to seek out racialized perspectives, to do some digging, to look for the perspectives that aren't common in physiotherapy literature and practices, the racialized perspectives, Indigenous perspectives, disabled, queer, and other perspectives. And I acknowledge that there's my own taken for granted assumption here that that there may not be diversity in the folks that are attending this webinar. There may be folks that come from these social locations. There may be folks, and likely are folks on this call, that are already doing this. And so it's an invitation to call others in, to be part of this together. And this isn't an individual call, but a call for the college, a call for university programs, a call to policymakers and researchers to draw in the silence perspectives and consider, and not only consider, but ask, how can these perspectives change and enhance our physiotherapy practices, and for myself as an occupational therapist, also enhance my practice. Here, here's a slide with some additional resources. Check them out, some videos when you have some spare time. The first one is around critical perspectives on disability. The second is on power, privilege, and disadvantage in physiotherapy, a symposium presentation and a panel presentation. And then the last one is an inside-out approach for practitioners on anti-racist and culturally safe practice. This is a presentation from Angie Phoenix and Karina Valavera, both Indigenous occupational therapists, discussing implications for rehabilitation practitioners. So that's the end of our presentation. Thank you for attending. Thank you to anyone that's also accessing this recording after the fact. I'm always open to having a conversation. If anyone's looking to engage by email or want to chat further, please feel free to reach out.
All right. Thanks very much, Ed and Tim. We do have a few questions for you before we do finish the webinar off. So the first one is, how do clinicians, or I guess in some ways, even frontline staff or management, take these ideas of critical perspectives and actually apply them into their practice?
Yeah, thanks, Sean. Yeah, how do we do this? How do you bring it into practice? For me, my experience has been to start with the conversation, to intentionally make it a collective endeavor, a collective enactment. That might be in the form of maybe a reading group or a discussion group, and then collectively decide, well, how might we do this? What does cultural safety look like in physiotherapy practice, and what small steps can we take to make our practice more culturally safe? Maybe that involves changing initial assessment procedures in ways that open up to developing relationships with clients and their families, people who come from First Peoples, people who come from Indigenous cultures. How might consent processes be different? How might we be responsive in our practice rather than having standard and universal approaches to initial assessment? So there isn't necessarily a recipe, but to consider a starting point is to dig into those other perspectives, see what culturally safe practice might look like, and then start to take small steps together. Ed, I don't know if you want to add something else to that.
Yeah, no, that's great. Off the bat, I think the word application sometimes is difficult because, as we did mention in the beginning of the presentation, for us as individuals to apply this maybe to our clinic is quite difficult because it isn't so much an individual endeavor necessarily and a matter of applying something in practice as much as it is changing our perspective on how we approach healthcare, which is a very broad, I understand, and a bit ambiguous. But if anything, I would encourage whoever's listening to be open to exploring critical theory and alternative perspectives and inclusion of marginalized people in a more intentional manner, more so than being too concerned with direct applications to the clinic tomorrow morning, for example. If your practice doesn't change within the next 3-4 weeks, that's perfectly fine. That's not what this presentation or what critical theory I think necessarily aims to do. It's more of a reorientation of our perspectives of who might be missing out. And the moment we do that, we start seeing healthcare differently. I also just want to bring up the fact that I think being not critical in that negative or pessimistic about the profession, but I think critical in that we look at the taken for granted assumptions within the culture of physiotherapy is one way of applying critical theory to the profession. For example, a basic example might be that a physiotherapist has power over the client, right? The client comes in and is under our kind of control. What might it look like if we take a diverse group of people and have them determine what physiotherapy, what the clinic space should look like to be culturally safe for them, so that they feel like they can access physiotherapy services? There might be a discussion with community members within a particular group, and so that would be one way you go about making one's clinic more culturally safe. But that once again doesn't address the physiotherapy culture as well. So I think it's a broad and a very big topic, and lots can be done in many areas. But I would just say we should probably be careful to try apply something as individuals tomorrow morning to our clients, if that makes sense. I don't know if that makes much sense.
No, I think that answers the question. The other question we had was, I think when you talk about ableism, I think in some ways that's what physiotherapy is, getting those who are unable to do, whether it's self-care, return to activities, recovery of function after injury. So I think as PTs, like, how do we, I think, manage that concept of ableism with our patients?
I'll jump in first, and now I'll turn to Ed, who is a physio. I've heard one therapist just make a small shift in language in asking rather than what is the problem, and what is the problem invites a universal approach to identifying problems that need fixing, that turns to standardized assessment tools without necessarily consulting with the client in front of you. So rather than what is the problem universal, it is what is the problem for you. And then from what is the problem for you invites to then explore that subjective experience of a problem, and that might involve different assessment tools. It might involve assessing in different ways, but that opens the door for an exploration beyond the universal idea of the identification of a problem in particular ways in physiotherapy. Ed, I don't know if you want to add something.
Yeah, it is difficult. But what I would, once again, I like the fact that Tim and I are both here, because I think Tim makes it practical, where I make it a little bit ambiguous. But I do think that whatever perspective either Tim or I will provide will be a perspective which is necessarily incomplete. It's not going to be a complete perspective on what to do about ableism, because neither Tim or I experience physical disability, and there's that phrase, nothing about us without us. So if we want to take a look at how we change our ableist tendencies within the profession, I would recommend we speak to our clients who experience stigmatization and marginalization and under our ableist kind of beliefs, and ask them what would make a a professional physiotherapist, one who is an ally. So I'd say that's probably the best place to start, which I'll add on to this, my own perspectives, but I would 100% start with the perspective of individuals who are experiencing disability. But I do think within physiotherapy, we are trying to get people back to function as normal, quote unquote, rather than moving people towards what is important to them necessarily. So that I think is pretty important. Quite often we have a preconceived idea of people need to get out of wheelchairs and walk, or people need to go from walking to running, trying to get to these higher, quote unquote, normal functions, where that is an assumption we take into physiotherapy without taking a look at whether or not that's even important for the person, and whether or not that's our taken for granted assumptions about what everybody needs to do to be a good human. Once again, I'm going to be quoting, I'm air quoting, if I know nobody can see it, but so that's pretty important. I will just, maybe one last thing, I'll just share a story about one of my friends who's been a coach for para athletes for a while, and she described an instance where there's something we can't avoid, is also internalized ableism, where she has to deal with two groups of people. The one group was this younger group of people who were born with congenital conditions which make them by society's standards disabled. And the other group of people were more middle-aged individuals who had acquired their injuries, middle age. And she had to separate the two groups because she found that the people who were born in a more socially normal kind of ableness, when they experienced their disability, they're extremely negative about their body, and they spoke very negatively about their body and about hatred for their body, and they're still getting over this internalized ableism, which is acquired through society, where a lot of the younger folk had been surrounded by people who loved their bodies and loved what they're able to do and loved the way that they could compete in sports. And so they have to separate them because they realize the real risk of negatively affecting and also putting these ableist beliefs onto the younger folk. So we've got to also recognize that although we might treat people in the clinic, we could also project our own ableist perspectives onto them as well, and in whatever kind of hidden way there might be.
Can I jump back?
Thanks for,
Sean?
Yeah, you bet.
Sean, I'm not sure if there's another question. I just wanted to share a story. In 2019, I had oral surgery on my tongue. I had a sizable portion of my tongue cut off. I had a cancer in my tongue, and after having surgery, I had a lot of difficulty with speaking, and went through a long recovery process and spent some time in speech pathology. Now, the speech pathologist identified the problems with my speech, and offered suggestions on how I might return to normal speech, that I might articulate properly and be able to enunciate in proper ways. I was given exercises. I was given activities to do, and I hated it. There was a standardized approach for how I was to return to speaking normally, and it didn't work for me. I felt like I was just another patient. I felt invisible. I felt like all I was seeing was my speaking impairment. And so I didn't do anything. And what I did end up doing is I ended up connecting with someone who had also had an oral surgery, and they asked me, "What do you want to achieve? do you want to get? What do you want from your speech? Do you want normal speech? And I said, no, I don't want normal speech. I just want people to understand me. And so they gave me some tips on what worked for them. They said, well, what do you want to be understood? And I said, well, I'm a professor. I'm a lecturer. I speak publicly about concepts. And they said, well, go find your most complicated reading that you can find and just start reading it out loud. Stand in your office and project it. And so I did. I just started reading that. I intentionally read books to my kids. And I found myself, once I'd done that, that some of the tips from the speech therapist started to become relevant. As I was reading aloud theoretical papers, then I started to imagine some of the things that the speech pathologist invited me to consider. But now I feel like I'm understandable for the most part, but I don't hold my tongue the way the speech pathologist wants me to. I don't speak in the way that was required, but I found a way to achieve speech that I wanted.
Thanks, Tim. We just have one more question that just came in. So what are some tools or ideas for including different perspectives in clinical research, from planning to operationalizing a project to analyzing the results, looking for practical suggestions?
Yeah, thanks for the question. We might be a little bit of a broken record here, but it's to bring those diverse perspectives to our research teams, where that people that often aren't included have an influence on generating research questions. So rather than bringing in a disabled perspective, bringing in a racialized perspective, bringing in a queer perspective, once the research has been developed, bring in those voices when you're developing the research questions. Have a steering committee that can hold you accountable, and some sort of a collective that can encourage us to bring to the surface anything that's being silenced in our projects. So this is an invitation to doing things collectively, so that we can be attentive to the ways that we're silencing some perspectives and elevating others.
Yeah, sorry, just to kind of maybe answer that as well. There is also a reference to a paper which I think is only one sliver of the whole story. But if we need an answer as to what to do, there is a paper that does guide and it's quite helpful. It's called the 7-Step Framework for Critical Analysis, and its application in the field of physical therapy. And that's by Stephen Nixon and others. Barbara Gibson's also in the reference list if you need to find that, but I'm sure we can add it to the slide notes. But it does talk about how to use critical analysis within physiotherapy and how it helps us kind of uncover some of our taken for granted assumptions.
Okay, I think that is it for questions. I would like to take a moment just to thank Tim and Ed for coming today and presenting the work that they're working on. I think kind of it's been very helpful for us to kind of help understand kind of how we frame our day-to-day lives and our work as clinicians. I'd like to thank the audience for attending. There are recordings that will be up on the website within a couple days, as well as handouts that are available. I would also appreciate taking a few minutes to complete the survey found at the bottom right of your screen beside the Speaker Bio tab. Input is helpful in identifying relevant topics and ensuring that our webinars meet your needs. Our next webinar is November 17th with Aliki Thomas on adopting evidence into practice, strategies to bring your practice into closer alignment with evidence. And I would like to thank Tim and Ed once more. Thanks very much, and I hope you guys have a wonderful day.